This presentation is on the Functional Communication Profile Revised, also known as the Fcp-R. The purpose of the Fcp-R is to assess individuals with developmental or acquired delays on 11 different communication skills. These include sensory, motor, attentiveness, receptive language, expressive language, pragmatic and social language, speech, voice, oral, fluency, and nonverbal communication. This test can be used on patients from ages 3 years to adulthood, or individuals with a low mental age of 1 month or greater. The test items reflect language and behaviors associated with specific disorders, such as those with autism spectrum disorder. The Fcp-R is an updated version of the FCP originally published in 1994. The Fcp-R gives an overall inventory of an individual's communication abilities. This is done through direct observation, reports given from the caregiver, and direct one-on-one testing. The test content accounts for diversity among patients. This test is not standardized and can be used in conjunction with a standardized test to create narrative about a client. This ensures that a holistic view of the client is recognized. Since the Fcp-R is not standardized, there are no age reference or severity norms. Instead of classifying clients in relation to others as norm reference tests do, the Fcp-R reports how well clients are doing relative to a predetermined performance level. Scores are based on the clinician's judgment and the clinical experience, therefore results may vary from clinician to clinician. Sensory motor tests fine motor skills, self-help skills, gross motor skills, auditory and visual skills. Attentiveness tests attention span, response level, cooperation and level of awareness, and environmental events. Receptive language tests comprehension of both verbal and nonverbal concepts, ability to follow commands, interest in objects and object recognition. Expressive language tests verbal and nonverbal communication, self-expression, object use and interaction, cause and effect, phrase length, vocabulary, and grammar. Pragmatic and social language tests communicative intent and conversational skills, including topic initiation, turn-taking, maintenance of a topic, elaboration, appropriateness of communication, reading, writing, spelling, and memory. Speech tests intelligibility of produced sounds, dentition, imitation, and articulation. Voice tests vocal loudness, pitch, and vocal quality. The oral section tests breathing, drooling, tongue thrust, and swallowing. The fluency section tests rate of speech, rhythm, and intonation. The non-oral communication tests sign language usage, fine motor abilities, effectiveness of current alternative communication systems, yes, no, and two-dimensional expression. The testing materials include the examiner's manual, the Functional Communication Profile revised forms, and assorted manipulatives that are not included in the test package. This is a picture of the examiner's manual. The manual includes purpose, overview, suggested use, administration time, scoring and how to score the subscales in great detail, test item selection, prompting levels, and materials. This is the Fcp-R form. When administering the tests, first the clinician completes the top of the first page. The clinician will gather personal information such as name and date. The client's skills are also rated on this page from normal to profound. Next, the clinician will state type of evaluation and the method of administration being used. Next, the clinician prepares for the assessment, which includes gathering age-appropriate materials. Then the clinician can begin the test, starting with the first subscale. The clinician will rate the client's performance for each item. If the client doesn't demonstrate a behavior, the clinician must mark none, unable, or non-applicable. Lastly, the summary portion is filled out and the clinician can add comments based on the performance of each subscale. The Fcp-R does not provide any testing materials, but there is a list of suggested materials that may be used. Here is a list of suggested materials. It is up to the clinician to select age-appropriate stimulus for the clients. Some of these materials include daily living objects such as utensils, soap, washcloth, and other grooming items, line drawings, photos of common objects, actions, people, or places, noisemakers such as bells, rattles, cell phone, pager, or a box of cereal. For certain populations, the clinician may want to use alternate communication systems. The client is rated on various factors, including severity of impairment, mode of communication, frequency of occurrence, degree of independence, assistance and prompting needed, inventory skills, and quality of performance. Michaela Cooper is a 3.5-year-old female who currently attends preschool. She has recently been diagnosed with childhood disintegrative disorder, also known as Heller syndrome, a rare disorder on the autism spectrum. Michaela's mother is a stay-at-home mom, while her father is an electrician. Michaela is the youngest of 3 children, and her mother reports that she had a healthy and normal full-term pregnancy. There is no history of autism or language disorders in their family. In comparison to her 2 brothers, Michaela's parents say that her language was developing normally until the age of 2. At the age of 3 years old, Michaela's language began to decrease. During her first 2 years of life, Michaela had been able to produce 2 to 3 word utterances and had a typical vocabulary of approximately 50 words. She has also stopped making eye contact when she communicates and shows a decrease in attentiveness. Her parents and preschool teacher both report that they have seen a dramatic change in her communication skills. Michaela enjoys drawing and playing with her classmates. However, her preschool teacher reports that over the last 6 months, she has begun to lose the ability to grasp crayons and has lost interest in interacting with her classmates. Michaela's parents state that although she was potty trained at 27 months, she has lost bladder control and frequently has bathroom accidents. In addition, Michaela's parents have noticed that Michaela has stopped responding to simple commands, such as being asked to point to objects in her storybooks.
Okay, Michaela, you ready? We're going to read a book. Do you want to read 5 Silly Monkeys? Look at all those monkeys. Can you see all the monkeys on there? All right. 5 silly monkeys jumping on the bed. One fell off and bumped his head. Oh no, can you see that monkey? He fell off the bed. Mama called the doctor and the doctor said, "Look, Michaela, no more monkeys jumping on the bed." 4 silly monkeys eating on the bed. Michaela, look at all the monkeys. They're eating on the bed. Look, they have a hot dog, ice cream, cookies. One fell off and bumped his head. Mama called the doctor and the doctor said, "No more monkeys eating on the bed." Look, here are 2 pictures of bread. And there's even jelly on the bread. Look how good. Okay, so one of these pieces of bread is big and one of them is small. Michaela, look. One of these pieces of bread is big and one is small. Can you point to the piece of bread that is big? Look, point. Can you point to one of them? Which one's big? Just point to one. Just point to the big one, please. Okay, that one is a small one. This piece of bread is big. Okay? All right, let's look at the next pictures. Look, there's 2 jars. Michaela, look. There's 2 jars here. One of them has cookies in them. Which one has cookies? Cookie. Good. Okay, Michaela, I'm going to show you some pictures. I'm going to ask you to tell me what is in the pictures. So look at this. Do you know what this is a picture of? Can you tell me what this is? Look. Tree. Good. Look at this picture. What is this a picture of? Can you tell me what this is? Do you know what this is? This is a bird. Can you say bird? Bird. Good. All right, look at this picture. Okay, look. Do you know what this is? Can you tell me what this is? This is a balloon. Can you say balloon? Balloon. Good. Ooh, Michaela, look at these crayons. I'm going to ask you what color they are, okay? What color is this? What color is this? Look. What color is that? Circle. Yeah, that's a circle, but what color is that circle?
Black.
Good. All right. What color is this crayon? You want to hold it? What color is that crayon?
Crayon.
Yeah, it's a crayon. Look. What color is that? That's blue. Can you say blue?
Blue.
Good. What color crayon is this?
Crayon.
Yeah, that's a crayon. What color is it?
Circle.
Oh, this is yellow. Can you say yellow?
Yellow.
Good. I'm going to draw a yellow triangle. Can you say triangle?
Yellow.
Good. And this is a yellow triangle. What color crayon is this?
Red.
Oh, close. This is orange. Can you say orange?
Orange.
Good. I'm going to draw an orange square. Michaela, your mom tells me that you love to draw. Would you like to draw something with these crayons? Can you hold that?
Crayon.
Yeah, can you hold it and draw something with it? Look. Hold the crayon like this. Can you hold it in your hand and draw? Okay, I'm going to draw a circle. Can you draw with that crayon? Hold it like this in your fingers. How about do you want to draw with the purple crayon? Can you hold it? Can you hold it like this in your fingers? Ooh, pretty. How about with the pink crayon? Do you want to draw with the pink crayon?
Pink.
Can you hold it like this in your hand and draw? How you doing today?
Michaela.
Yeah.
Happy.
Oh, good. I'm happy too. All right. Well, your mommy tells me that you have a dog. What is your dog's name? Michaela, what's your dog's name?
Oh. Wolf.
Oh. Yeah, dog was Woof. Is your dog's name?
Rufus.
Oh, Rufus. Is your brother older than you or younger than you? Do you know?
Boy.
Can you look at me when you're talking, Michaela? Michaela, what's your brother's name?
Boy.
Yeah, he's a boy. His name is Sean, right?
Sean.
Do you like to play with Sean?
Love Sean. Sean.
Your mommy tells me that you go to the park with Sean. What do you do at the park?
Rufus.
The FCP-R clearly states that there is no definitive scoring system. Clinical judgment is necessary when administering the FCP-R and scoring the subscales. As you can see in the picture provided, there are multiple boxes that can be checked off to rate the performance of each task. The examiner's manual clearly states what each rating means in great detail.